Hi, my name is Jess Whitnauer, and I'm an Illinois State dietetic intern. And today I'm going to be talking to you about oral nutrition supplements and how we can use them to bridge the gap in patient care. So the purpose of this presentation is to educate hospital food service employees, kitchen managers, and dietary staff members about the importance of nutrition supplements to improve patient outcomes and increase overall compliance to their diet orders. Some objectives of what we're going to be discussing today include identifying companies and brands of popular oral nutrition supplements, or ONS for short, in hospital food service. We're going to be recognizing the need for ONS to prevent further malnutrition and other health complications. And then we're going to promote ONS in light of recent events due to the COVID-19 pandemic. And lastly, we're going to be discussing barriers in the delivery of ONS and come up with some ways to improve patient outcomes and overall compliance. So first we need to know what oral nutrition supplements are. ONS is concentrated forms of nutrition, whether it's focusing on protein or focusing on calories, and it's used in addition to normal food intake, to improve the nutritional status of patients at risk for malnutrition. We have a couple forms that are common. We have liquid, gel, powder, or bars. Liquid is usually the most common though. They also come in ready-to-drink bottles, or you might see them in more concentrated varieties that need to be reconstituted at bedside. And then ONS usually contain a different amounts of calories, protein, fat, vitamins, minerals, and we want to meet the patient's needs. And so this is primarily determined by the dietitian. ONS typically contain 200 to 600 calories and 8 to 20 grams of protein per serving. So looking at some popular companies and brands of ONS, we have two major ones, the first being Abbott and the second being Nestle. And then Abbott products include Ensure, Juven, Glucerna, Nepro, and the Nestle products include Boost, Resource, Impact, or you might see the Carnation Breakfast. And then there is two additional ones I'll mention. You might hear these from patients or other hospitals that might carry these, but Herbalife Nutrition and Amway also has a couple varieties as well. So there's many different types of oral nutrition supplements. They're always coming out with new ones, but there's an original nutrition blend, as seen in the picture here, Ensure. And it's high in calories, high in protein, vitamins, and minerals. It can be found in the shake, powder, or pudding variety, and this is kind of used for overall weight gain. On the right, you'll see the Boost Plus. This is the Nutrition Plus. This is higher calories, higher protein, but it is in a lower volume, so it's more concentrated for the patient. And then we have a pre and post-surgery blend as well. So maybe if the person is trying to prepare their body for surgery, or if they're trying to recover after surgery from an ulcer, this would focus on the immune system and overall recovery. Moving on, we have a probiotic drink mix that can be used to promote gut health, alleviate symptoms. It's usually going to be high in protein, calcium, and vitamin D, as seen here. We have a couple hydration formulas that can be used for patients having excessive diarrhea or fluid loss. They can restore electrolyte balance. And then lastly, we have a thickened varieties, known as nectar, honey, or pudding thick, and this is primarily determined by the International Dysphagia Diet Standardization Initiative. That is a mouthful, but we call it IDSI for short. And this is used for dysphagia patients, or maybe the patient has difficulty swallowing, suffered a stroke recently, things like that. So why are ONS important? So in the following slides, I'll discuss a couple reasons and about these in detail, but the three I'll mention here is malnutrition. And malnutrition is common in about 30% of hospital patients, so it's a pretty big deal. And then sarcopenia and muscle mass preservation. We want to make sure that we are not allowing our body to steal from our muscles. Oftentimes, if we are not getting enough calories, it'll steal from our bones and our muscles to feed our brain first and our vital organs, so we want to prevent that. And then bone mineral density as well, so we want to prevent falls and fractures from occurring, and this kind of goes hand in hand with sarcopenia. So first off, looking at malnutrition and what that looks like. I have a question here for you. Which one of these people suffers from malnutrition? And you might think this is a pretty easy question, but the person on the right is an older woman, and the left is a younger person. In reality, both of these people could be suffering from malnutrition. And the reason why is that it can be an overnutrition or an undernutrition. Oxford Language defines it as a lack of proper nutrition caused by not having enough to eat, not eating enough of the right things, or being unable to use the food that they do eat. So as you can tell, undernourished people can also be overweight if they eat a diet high in energy or calories, but low in nutrients. So we can see this in the hospital occasionally. And then nurses and doctors are going to be screening for that malnutrition upon admission, but they do consult the dietitian and they do further assessments to find out which product would be appropriate for that patient. Next is sarcopenia. Sarcopenia is the progressive loss of muscle mass and strength. So as you can see in this graphic here, there's many different causes of sarcopenia, including sedentary lifestyle, changes in their hormone levels due to maybe medication changes. Maybe they have a disconnect between their brain and their muscle fibers. They can also have altered protein, the amount of protein that they make, and then they can also have an increase in inflammation. So there's many different reasons why we have sarcopenia, but the good news is that we can prevent sarcopenia from occurring and progression of sarcopenia through our good nutrition, and we can prevent the progressive aging that can occur with that as well. So sarcopenic obesity is something too to consider. It is the loss of muscle and gain of fat tissue, kind of what we saw earlier. Patients can see a loss of muscle. They might lose their actual muscle content, and we might perceive them to be gaining weight and doing better, but in reality they might just be gaining fat tissue, so that's something to be aware of. And they might still be on a nutrition supplement even though they're overweight. So the next thing is bone mineral density. It's highly related to muscle mass and muscle strength, and we want to prevent falls and fractures related to osteoporosis and that hollowing of our bones. So vitamin D supplementation or calcium and protein rich ONS might be prescribed to them. Some effects of ONS on the patient outcome. So when we use ONS, it can actually save 1 in 3 deaths related to malnutrition. We know that it can save 1 in 3 complications due to infections from hospital stays. So unfortunately, when a patient comes to the hospital, they like to get better. They're coming for a reason, but unfortunately, they can develop infections while they're staying there. And then we do see a 12% reduction in hospital costs, mainly due to the malnutrition diagnosis and the amount of staffing and ONS that we need for them. And then we do see a decrease in hospital length of stay as well. So here's another question. How much money is spent nationally on malnutrition caused by disease each year in the US? And the answer is $15.5 billion is actually spent. So it's a big chunk of change. And it's interesting to know that malnutrition is something that is preventable. So we do have the ability to prevent this loss. And I don't know about you, but I think I'd rather spend that $15.5 billion on something else. And then going forward, so looking at research of how I came to these conclusions and kind of support ONS in hospitals. There's 2 trials that we'll look at, one being the NOURISH trials, and the NOURISH trials saw a reduction in mortality rates 3 months after the trial ended with their intervention, but then after discharge, they did see an increase in mortality. And then EFFORT trials, they looked at the effects of malnutrition treatment with nutrition support. They found that if you treat 25 patients with ONS, you can prevent 1 severe complication due to malnutrition. They also found if you treat 37 patients with ONS, you can save 1 person's life. And I think it's important to consider these going forward and to consider the use of ONS and how it is being studied a lot recently. So we want to talk next about the impact of ONS for COVID-19 patients. So the question is a patient with COVID-19 at a higher risk for malnutrition, and why? Every day we're discovering new things about this virus, how it's changing, but we do know a couple things. It's higher. A person with COVID-19 has a higher metabolism. They are going to require higher energy needs, so we can meet that with ONS. Inflammation is prevalent in COVID-19 patients. They're trying to fight off that virus. And then this is also alongside their existing comorbidities. We see a taste and smell sensitivities change. This is probably one of the biggest reasons. 65 to 85% have decreased sensitivity, causing the patient to not want to eat at all. And so we need to supplement them and make sure that they're staying well fed. And unfortunately, we see mechanically ventilated patients existing and having further complications with the virus. So this also creates difficulty eating and drinking for those patients. So how can we improve patient compliance is the big thing. First, I think knowledge is the best way to start. We want to assess why the delivery system isn't working. We want to assess all the different barriers to that person getting that ONS and actually taking it. So maybe taste is a problem. Maybe tolerance. Maybe they can't digest it. Maybe they're forgetting to take the supplement. Maybe the staffing just isn't there. Maybe the timing of the supplement administration is failing. And then overall knowledge of what the supplement is doing for the patient. Once we have those things figured out, we want to communicate that with the supervisor, the RD, or the nurse, and we want to make sure to be mindful of their medications, their upcoming surgeries, and maybe their physical therapy. And then next, we want to prioritize what problems do we see in that patient, what things can we do for that individual patient to meet their needs. Maybe it's as simple as switching out a different flavor of the ONS, or maybe it's switching to a different kind of brand. But then the last thing is to get creative. We want to provide individualized, patient-centered care to encourage desired outcomes, and we want to work back with our team members to create the best outcome. And then also just not be afraid to go back to step one and reassessing the reason why we're making those changes and what we can do better. So strategies to improve patient compliance. These are some suggestions that other hospitals have used. Delivering the ONS between mealtimes is a good idea instead of during mealtimes because they might be full. Being mindful of when they're taking their medications. You also might consider using a chart to monitor the intake of their ONS, having patients take responsibility for their own nutrition. Switching to a higher density formula, you can talk to your dietitian about that. Making sure the staff understands the reasoning for ONS and communicating that. And then furthermore, just having the motivation and the empowerment and the positivity that that patient is requiring to comply. So here's my summary slide. We talked about a couple of varieties and brands of ONS. We talked about the reasoning, why it's important, why we need ONS. We talked about malnutrition. And then we also talked about some barriers of ONS delivery and compliance and how we can actually achieve patient compliance through individualized care. Here are my sources if you want to look back on those. And then I just want to say a big thank you, and here's my contact information if you have any questions about the content here. And thank you so much for joining me.